Today, we're going to look at COVID and bone health. We're seeing that COVID has a significant negative effect on bone health. Musculoskeletal manifestations include fatigue, joint pain, muscle pain, new onset back pain, muscle weakness, and poor overall physical performance. Where we've also seen that the degree of local and systemic bone loss is related to the degree of inflammatory reaction, so how severe the COVID reaction was, and that even after treatment for this inflammation-induced bone loss, it can still continue after the treatment has been provided. So in a quick overview of bones, we have osteoclastic activity, which is when we have macrophages breaking down old bone tissue. And then we have osteoblastic activity, which is the creation of new bone tissue. And this is constantly ongoing, so whenever we exercise or stress our bones out like that, we have some dissolving of any microfractures and then the formation of new, stronger bone to compensate for that. Knowing this, in a study on mice infected with COVID, they had a sharp increase in osteoclastic activity, that bone loss. And there was a large amount of this within 2 weeks after infection, even if you were asymptomatic. Even if the mouse was not showing symptoms, they had significant bone loss and reduced osteoblastic activity, that formation of new bone, reduced activity of that. In another study, hamsters were infected with COVID and they experienced significant bone loss, which extended into the post-COVID period after infection and passed into recovery, where long and trabecular bones of the lumbar vertebrae experience this. So your spine is getting weaker after a COVID infection. And this is theorized to be due to that inflammatory cytokine storm that occurs with COVID. You can skip this part and I'll tell you when to cue back in when you're scrolling if you don't want to learn about the inflammatory markers. So interleukin-1 can stimulate osteoclastogenesis. So this is that breakdown of bones. It can stimulate that, while also inhibiting bone formation by directly activating a rank-mediated signaling pathway, strongly promoting bone and cartilage destruction like in the spine. Tumor necrosis factor alpha can inhibit osteoblastic activity, so this is inhibiting the formation of new bone cells, while also stimulating osteoclastic proliferation, so it's stimulating the degeneration of the bone and cartilage as well. Then we have interleukin-6, which has been proven to directly trigger osteoclastic formation and induce bone resorption. And then we also have interleukin-17A, which plays a major role in bone loss and cartilage damage by inhibiting chondrogenesis, which is a fancy word for the growth and development of vertebra and cartilage. For our skippers, you can cue back in right here. So osteoporosis is when you have low bone mass, normal mineralization, and abnormal bone microarchitecture. Typically, this is something that occurs in very old age, especially with reduced physical activity and malnutrition. Now, some COVID-19 patients have osteoporosis as a complication due to COVID causing the cytokine storm, shifting the balance between bone resorption and bone formation to just the bone resorption. So this bone is being destroyed by your own body's immune system, which is causing the weaker bones, the osteoporosis. Now, this is important for men especially. We've seen that COVID causes low testosterone levels in men. And it's known that having low testosterone levels is correlated very highly with osteoporosis. This means that COVID-caused low testosterone can cause your bones to become brittle and weak. Where men with COVID had significantly lower total testosterone levels than healthy controls, and another cohort study actually showed that 50% of men who had recovered from COVID still had low levels 7 months after. So remember, back with the GI health, vitamin D is also important for maintaining bone mass, calcium homeostasis, and extraskeletal health. And based off of our current knowledge, the general agreement is that if you have a serum level for this vitamin D less than 30 nanomoles per liter, then this is sort of like a bad reference range. However, this is targeted towards an older population. But it has been correlated with all these bad things like hyperparathyroidism, mineralization defects in the bone, decrease in bone mineral density, etc. So these low vitamin D levels are going to be critical to monitor, especially after the COVID infection and during the COVID infection, because it's correlated with a worse prognosis in the long term. So yes, COVID impacts your bone health. Whether it's directly or indirectly, COVID causes a significant loss of bone mineral density after infection in patients, regardless of severity and regardless of if you have long COVID or not.